right, hey, welcome back, everybody. Been a little while since I've made a video. Um, just kind of been quite busy with getting back to normal with COVID, and also been busy with a bunch of people suffering with OCD that have been working with me and doing really well, most of them, and it's really been awesome for me to see people making progress. I have a lot of people that claim that they're OCD free, and at the very least are have much more freedom from OCD and are headed in the right direction. And so today I want to talk about something not really at all related to exposure response prevention or meditation or acceptance, any of that stuff. I want to talk about psilocybin and its various uses and how it's now being studied by a number of very well-respected hospitals around the world and programs with different neurologists and neuroscientists and psychologists and psychiatrists as well. And my guess is most of you have come across some sort of article about the use of psilocybin or other psychedelics in the treatment of anxiety, depression, OCD specifically. And I know I've been reading about this stuff for years, but the truth is, it never appealed to me on like a personal level. I didn't like the idea of taking psychedelics. I don't. I was never a drug guy, even back before I ever was hit with any OCD. Smoking weed always makes me feel funky. Drinking alcohol was pretty much the one thing that I did. And so I always had an aversion to this whole idea of taking mushrooms or LSD or any of these other psychedelics that people are now claiming are changing their lives for the better. Okay. Now, I mean, just to state, I'm not a medical doctor. I'm just going to give you my personal experiences so far and encourage you to do some research on your own. You might be like me where you hear the idea of this and think like, that's insane. I would never, ever do that. I would just encourage you to look at the research that's being done. This might be a real game changer for anxiety, especially for depression. The results that are coming out from the clinical trials that are being conducted are really miraculous. And so for those of you who follow me and know my story, you know that I haven't really suffered from OCD in quite a while, especially HOCD. I did the treatment for HOCD. I really got into the treatment. I helped, I used mindfulness meditation as an aid in my recovery. And I finally got to a point where I was like, yo, I'm not thinking about this at all anymore. It didn't matter. I didn't feel like I had to answer a question. Didn't even feel like there was a question. But there are still things that just in general, I wanted to see if psilocybin would help with. And one issue that continues to sort of plague me is trouble sleeping. And I do think it's somehow anxiety related. It could be depression related. I have trouble falling asleep. Oftentimes I wake up early and have trouble getting back to sleep. And it definitely creates this cycle. If I have too many of those nights in a row, I start to feel those old symptoms of OCD. I mean, really bad anxiety. I start to get depressed. And so just in general, I wanted to experiment with what's called microdosing. taking an extremely small dose of a psychedelic, such a small dose that it doesn't give you any, hallucinogenic effect at all. And so generally what you do is you take about a tenth of what is considered a full dose, a dose that you would take to actually hallucinate. So what that could mean is anywhere from 0.1 to 0.3 grams, depending on your own tolerance, your weight, your size, and possibly, and this is worth researching on your own a little more, if you are currently taking an SSRI or if you have taken an SSRI in the past. The research that I've done on this so far suggests that both psilocybin and SSRIs work on the same chemical area of the brain. They're both serotonergic, you pronounce that word. And so they operate on your serotonin levels. And I'm not going to pretend that I know all the intricacies of exactly what happens. I don't think they know exactly what happens. But the findings have been that people that are on an SSRI don't seem to be getting the same amount of benefits. And even people who have been on a heavy dose of SSRI in the past, and they're not on them still, they're seeing, at least in some studies have been done, that they're not getting the benefit that others are getting, which when I first read that was bad news to me. I didn't want to hear that because I had taken Lexapro for years, even like a very small dose. And so I actually tried taking more of a full dose a couple months ago just to see. I didn't want to take like 1.75 is considered to be the sort of minimal dose to have like a hallucinogenic experience. And so I tried taking like 0.5. I took 1 gram one time. And to be honest, I wasn't feeling anything. And the people that have more experience with it than I do, friends of mine who take it more as a party drug, again, which I wasn't interested in, found it odd that I wasn't having any effect. And so it made me wonder, could this be because I'm on a small dose still of Lexapro, or could it be that I've been on a larger dose of Lexapro for a long time? And so I decided, and again, talk to your psychiatrist or your therapist if you're working with anyone professionally, even just your primary care doctor. What I had researched indicated that if you're trying to wean off of an SSRI, that psilocybin can help tremendously. And so I'm already on a sub-therapeutic dose of Lexapro. I take 0.5. So I take one 10 milligram pill and I cut it in half. I've been doing that for years. And the reason I do that is because my psychiatrist that I went to, and also therapist that I had worked to, Grayson, says this. I think he even says it in his book. And they kind of operated on the same theory that as long as you keep it in your system at a low dose, if you feel like you need to dose up again, it's much more effective than if you completely stop taking it. Because if you completely stop taking it, their findings were that it may not be as effective. It may not take root again if you try to take it. And I hated hearing that because, like almost all of you, I wanted to get off of my SSRI. I haven't met one person who has OCD that likes the idea of being on an SSRI. All of them are like, I need to get off this. And I would put it this way. I don't think I had any real bad side effects at all from the Lexapro. And so if it was helping me even just a little bit, that's fine by me. I mean, if you are having actual bad side effects and you really feel like you need to get off your SSRI, look into this, do a little research. All right, sorry, I'm yammering on here. Anyway, I've been doing maybe 4 weeks now of microdosing once every 3 days. And I have found that my microdose level that gives me the intended consequence of taking a small dose, which is your mood just feels better. You feel sharper. You feel clearer. You feel you have like more ambition. You're able to just get up and do stuff. And I know over the years, and who knows, maybe with all the meditation that I've done too, I've created this kind of just like, nah, which is fine. It's much better than being OCD guy and being wound up all the time. But definitely, I have days where I would rather not get out of bed, and days where I'm just being lazy. I don't get anything accomplished. And so microdosing so far, I'm not going to say like this has been the game changer of game changers for me, but definitely noticing all of those things that most people talk about, a sense of clarity, any anxiety that I do have just lingering, I have found that to be even lower, which is great. I mean, the road that I'm on here is like to continue to try to make progress to feel as at peace and as content as possible. And also, I have noticed definite improvements in my sleep, like sleeping straight through the night, waking up, feeling really good. And yeah, as far as any depressive symptoms, I don't think that I have nearly the levels of depression that I had definitely when my OCD was really sky high. But like I said, I have days where my mood just seems low, and sure, I do all the stuff that I've talked about in all of these videos. I meditate with it. I allow the feeling to be there. But if you can feel a little bit more chipper, then why not, So that's been my experience so far with microdosing. I definitely think, one other thing I want to talk about here is almost all of the research also indicates that taking a full dose, like an actual hallucinogenic dose, under controlled conditions, with someone who knows what they're doing, with someone who might have some Ativan or something nearby in case you start having a bad trip, as they call it. But going through that actual psychedelic phase, just go do some research on what people say, how they feel afterwards, the changes that they feel, and not just for like a couple days, but most of these people that have been interviewed say that it's one of the top 5 most important moments that they've ever had in their lives. Behind, like right around stuff like getting married, having a child, taking a psilocybin trip is up there in the top 5 for, I think, something like over 60% of people that were polled on it. And so what they do show is that bigger trip, which I haven't done yet, I will keep you posted on that. The bigger trip tends to have these long-lasting rewiring your brain effects. Okay, I haven't done it, so I can't speak for the efficacy of it, but I've definitely been doing the microdosing now for probably 4 weeks, every 3rd day. Overall, it has provided me a lot of relief, and I have completely cut out my SSRI. So who knows? Maybe now that the SSRI is gone, the psilocybin is doing more of the thing that it's supposed to do. I really don't know. I don't think anyone is certain of that yet. But for the people who feel like this is crazy, wacky, nutty stuff, just take a look about microdosing. Do a Google search for psilocybin and anxiety, psilocybin and depression, psilocybin and OCD specifically. Pretty wonderful stuff. And I, from what I'm reading, it sounds like it will be available legally as a prescription medication, probably within a couple years, which is great. They're literally mushrooms that just grow in nature. That's it. So for people who feel like they don't like synthetic processed chemicals, yeah, you're eating a mushroom that grows naturally out of the ground, and I like the thought of that more, being someone who doesn't like to be putting a bunch of foreign stuff in my body. So cool. Other than that, yeah, I will try to post some more videos on OCD. I get so many questions literally every day. My inbox is flooded with people suffering from OCD, and I feel your pain. I really do feel your pain. And so there's been some good questions that have popped up that have been video worthy that I will try to address some stuff. But psilocybin, microdosing might be something you want to look into. And till next time, take care, guys.